Hello doctors, my name is Dr. Naseera Abdul Hameed, and in the last video we had discussed about Ayurveda Cosmetology and the Ashtangas. In today's video we'll start our aesthetic journey, and let's start it with the most popular one, which is the facials. Now what is a facial? The simplest definition of a facial would be a beauty treatment done for the face. Now it can range from simple massages you do at home to full-blown beauty treatments you do at parlors. Let's see what are the benefits of a facial. It helps to cleanse and hydrate your skin. It helps to make your skin soft and glowing. It helps to promote blood circulation. It helps to promote an even skin tone. It helps to reduce stress, and if done properly, if done regularly, it can prevent aging to a certain extent. How do we approach facials as an Ayurveda cosmetologist? Now the key word here would be Ayurveda. Alright, so we know that the basics of Ayurveda are the Tridoshas and the Panchamahabhutas. And we also know that in Ayurveda, no patient is treated the same. Everyone is different in their own ways. So as an Ayurveda cosmetologist, what can we take from this and apply it into cosmetology? The word which you have to follow is customization. You'll be wondering, what does customization have to do with Ayurveda cosmetology? Now, by customization, we mean understanding the needs of the patient, understanding the various aspects of the patient, and making an approach like that instead of sticking to a particular protocol. Now, let me explain this by an example. Now, this is a very common scenario which I usually find in my OP, is that two ladies or two people come to the OP, they may be friends. They may have totally different skin types. For example, in this case, let's take like one person has a normal skin type and the other person has oily skin type. Both of them come to me and say, Madam or Doctor, I want to do a facial. We want to do a facial, and both of us want to do, for example, let's say both of us want to do a fruit facial. So as a doctor, I am obliged to do it for them. But if I do the same facials in both the persons, will I get the same result? The normal facial for a person with normal skin might give us good results, but for an oily skin person, we have to make changes in the medicines we take, in the drugs we take, in the procedures we do, and then only then we'll get good results. So customization is very important as far as Ayurveda cosmetology is concerned, and because it is Ayurveda, we have a lot of customization in our texts, we have a lot of customization in our classics, which will be definitely helpful. A lot of young doctors face a lot of dilemmas. They have this basic, what I see among students and doctors is that they have this inertia towards cosmetology. They'll be wondering, like, because this is not a subject which you have studied in your college, you don't have a lot of mentors to look up to. So there is this basic inertia when they come to cosmetology. This video series is to help you with that. Now we talked about customization. Now about customization, we'll be talking about in detail. So usually when a patient comes to us, we have, keeping customization in mind, we have to approach the patient in two different ways. First and foremost, we have to understand their mindset. Now that is very, very important, because I am speaking from experience, and we'll talk about all these points in detail. And second thing is that you have to have a very basic and clear understanding of the anatomy and the physiology of the working of the human skin. Okay, so let's talk about mindset first. Anatomy and physiology we'll be dealing in the coming videos. Talking about the mindset, patients approach us, or clients approach us in two different ways. First set or first category would be people who come to the OP and say, Doctor, I want a facial, and that's it. Okay, they want a facial. And the second category is the patients come to us, they come and sit with us, they say, Doctor, please, what facial is best for me? What is my skin type? What aftercare should I do? And when you treat both of these are the two categories which you will definitely come across your OP. And when taking into consideration, you'll be wondering, how should I approach them? When you approach them, what you have to keep three things in mind, which is, first one is, you have to keep in mind their skin type. That is very important. We will be dealing skin types in the next coming videos, because skin is very, very important. Understanding, analyzing the skin type, your ability to analyze the skin type will define your success as a cosmetologist. Second one is requirements. that I will speak again in detail, which is something which I have gained from my experience. And third one is occasions. Now, I told about skin type. Skin type will be dealing in the coming videos. Requirements of patients. Now, when patients come to the OPD, they have certain requirements. Say, okay, for example, say the first one is they'll require like, okay, hyperpigmentation. This is the case, keep this in mind. Hyperpigmentation. They come and talk to us, and they come and sit in the OP and they say, doctor, I have this hyperpigmentation. It may be melasma, the usual melasma which we find over here. It may be acne scars. It may be any form of PAH. They'll say, doctor, I want to treat that. The second scenario which we can consider here, this is all for your understanding, okay, is for example, say it can be a case of open pores or acne scars. And the most common thing which people come to the OP is to increase their face color, to increase their skin complexion. What is important is that your skin should be at its best. Now, a lot of people will ask, what is the best? Best can be a skin free of blemishes, skin which is plump and hydrated, skin which has an even skin tone, and most importantly, a skin which is glowing in its own manner. Now, as told before, the benefits of facials are many, are abundant. But to understand facials and prescribe it to a patient in a very proper manner, it is important that we have a basic understanding of the anatomy and physiology of the skin, which we will be dealing in the next video. Until then, it's goodbye from Team Drona.